Yes.
Have you ever explored the use of trehalose as a sweetener instead of xylitol?
I have looked at trehalose. Yeah. And we're looking at other, there's other sweeteners like tagatose. Tagatose is really interesting. Allulose is interesting. Trehalose, I have looked at that. It's interesting. A lot of times when it comes to sweeteners, regulatory is a concern. So we're in 12 international markets and probably going to be in other markets here in the near future, potentially. And it's interesting with regulatory, a lot of countries, they have their own regulations. And so trehalose is not allowed in several markets in Asia. Yeah, it is. Stevia, stevia is not allowed in Japan unless it's done a certain way, So each country has their own regulations. And so when we develop formulas, we want to develop a formula that works for all of our 12 markets.
I have a question. So I work with a lot of physicians and treat a lot of Medicare patients that are chronically ill.
Can you guys hear this?
No.
Not so much? Speak up a little bit. Or stand up.
I'm Bob Baker. I work with physicians all across the United States that treat patients that are chronically ill, Medicare patients primarily. How do you convince a physician to use a 3 product to help make their patients get better? Because they're so used to prescribing medications. They're often paid by pharmaceutical companies to do that. And so I'm a huge fan of prevention and wellness, and that's what my company does, is treat chronically ill patients. How do you convince a physician to implement something like this when historically we're trained to write out prescription?
Yeah, you really can't convince someone. All you can do is show the data. And we've taken a pharmaceutical approach in the clinical studies, in the intellectual property that we use, that hopefully could be a benefit. Medical professionals, I don't know. So let me ask you, medical professionals, when you were receiving your training, how many classes did you take where they talked about like diet and nutrition and supplementation and stuff like that?
A lot. I'm a naturopathic doctor.
Okay, that's right. Wonderful. Integrative health, a lot. Traditional medical doctors. One class.
Yeah.
Okay. So the reason why I did that is a lot of it is trying to change the mindset of medical professionals. And the fact that you're here in the room means you're open-minded. And that's great. I love that. I have a lot of friends. I had a friend I just talked with the other day, went to Hopkins Medical School. And yeah, exactly. We have a Hopkins man over there, and Dr. Schneider. Dr. Schneider went to Johns Hopkins, one of the best medical schools in the world, as you know. And trying to talk with him and convincing him that supplements are an okay thing, he was always skeptical until we talk their language. What do we talk about? Molecules, right? When he was asking what you're doing, I'm like, oh, well, we found this molecule called this and this and this. And we ran an assay that this and this and this, and we found that it does that and that and that. And it's like, what? It changes their mindset when we use the language, because science is all about, health science is all about molecules. Okay. Here and then here.
Okay, Dr. Dan.
Let's wait for the mic.
So, Dr. Dan, I really appreciated the studies that you published on our absorption percentages compared to, and that's what I want to ask. What is it compared to when we have our absorption?
Yeah. The organic control in that absorption study is curcumin. The molecule curcumin. Yeah, so when we wanted to do a control and you have 6 different formulas with different molecules in them, right? You needed to find something that was kind of standardized. I needed to find something that was standardized across. And I found that curcumin was probably the best molecule to use because it's used in the supplement industry a lot. And when you look at its molecular characteristics and its functional groups and its hydrophobicity and molecular size, it fits into a pretty nice mold of a supplement molecule. And that's what I use. Great. Let's wait for the mic so we can all hear your beautiful voice.
How many the molecules in our the 6 product total?
You know, 2,700 maybe, close to 3,000. Yeah. Yeah. You're welcome. Yeah. So think about that. 3,000 molecules. When you are giving this system of products to someone, they're taking 3,000 molecules a day. I don't know about you, but that's exciting to me. Just think about the beautiful molecular structures of these molecules and how they're doing. And now they get into the body and they're conducting right. And the body's now, whoa, you know, good things are happening. Right here. We'll go here, here, here.
I'm like piggyback off of her question.
Yeah.
So if there's that many molecules in all the products, is it different ingredients or are they coming from like similar chemicals?
They're coming from different ingredients. So when we say curcumin, you have curcuminoids, and you have other molecules in curcumin. So just in curcumin alone, you probably have 12 molecules or so. Great question.
Dr. Dan,
Yeah.
how many phytonutrients are in acid?
Yeah, maybe 300.
Okay. Have they all been isolated?
No. Some cool ones have been isolated, like Thortin. Thortin's a freaking cool molecule. And, you know, different apples. So different apples have different qualities. So a red apple, like a Red Delicious, has a very different molecular composition, phytochemical composition than a green apple, like a Granny Smith. Really interesting. And the more tart the apple is, the more molecules, usually. Yeah. If you bite an apple that's really tart, kind of bitter, that's a sign that it has some freaking good molecules. Okay, next question. Yes.
Dr. Dan, hi.
Hi.
Bitter melon is always bitter. Is that why?
Yeah, mamortistan is bitter. This molecule that we have on the other side of the board, that's found in bitter melon, it's really bitter.
That's the reason why you think it is a good, ingredient for the supplements, because they're normally bitter. I mean, bitter melon are normally bitter.
They are. Mamortistan is bitter, and you know there's some molecules. So a lot of molecules that have health benefits are bitter. But some of them aren't.
I have actually another question. In each of the products, you have a label given the recommendation of how much you pay. But I heard some people are taking more than that. Is it really essential or safe to take more than the recommended dose that you have labeled in each of the products?
So let's have someone answer this. Dr. Bordeaux, do you want to answer this for us? Come on up. Dr. Schneider, do you want to grab the mic there? There's another mic by your feet. We can bounce around. We can bounce around mics. Let's come up.
Okay, so
Where are we?
I'll tell you what I tell my patients and customers and things like that. So we have the recommended dose, but these are natural plant-based supplements. And so if you feel like you could get added benefit from a little bit more because you feel like you might be deficient, for example, some people take Tubital Tay. If you feel like you're under the weather and you're going to take more immune, you can do that short term. If you exercise a lot and end up getting a lot of inflammation and post-exercise soreness, you can take more Revive. So within reason, it can be safe. It would be costly to take way more than recommended, but you can.
But at the same time, or you spread it out through the day?
Does it matter?
Does it matter?
I take my Revive and spread it out, But I think some people spread it out, and it just depends on what your needs are. For me, I say when you remember to take it is when you should. So if you feel like you're a little bit like, if I'm under the weather and I want to take more immune because I feel like I want to get and you know, feel better sooner, then I'm going to take more at one time, but that's just how I do it.
Yeah, and so when it comes to our recommended use, right, that recommended use was developed based on studies. And so if you want to take more, like Dr. Bordone said, our products, you know, you can take more. But what I would add to that is if you want to take more, you should just make sure that you talk with your medical doctor and they're okay with the ingredients that are in there based on your condition and everything that's going on in the body. Great, yes? Where's our mic? I was using two mics.
Hi, Dr. Dan.
As my daughters would say, awkward, embarrassing.
I have a question. So one thing that's really popular that I'm hearing on social media is about parasites. Do we have anything specifically in our 6 products that are going to target and help with parasites? Like maybe Purify? Is there anything in there that I know of?
Yeah, so molecules in Purify, like silibinin, which is part of milk thistle, can have some anti-parasitic effects. So it can actually paralyze parasites. So parasites, when they're swimming around in the intestinal tract, when they feel movement starting to happen, they dive into the cilia lining of the intestines and they hang out there and they hold on when the movement comes. And so silibinin and other molecules like that paralyze the parasites. There's some, so it's antispasmodic activity and properties. They paralyze the parasite so that when the movement comes, they can't swim in the lining in their flesh.
Milk thistle.
Milk
thistle's
thistle.
good for that.
Yeah.
Thank you.
Quercetin, immune?
What?
Quercetin, immune?
Quercetin?
Yeah.
Yeah, I mean the nanosilver can have some good benefits.
He's the one. Oh, okay.
Where are we at?
Right here.
Okay.
I think my question was sort of answered, and it was about taking additional doses. I know you were on a call with Dr. Snyder. You said, oh, you know, even up to 6 or 8 Revive per day.
Yeah.
So my question would it be still the 2 multiple times or 3 twice?
With
Like, does that make a difference?
Not really, because the pharmacokinetics of these products, right? You know, when you take these molecules, I should really turn around so we can see the beautiful molecules. But these molecules, right? Half-life of these is 12, 24 hours. You know, so they're going to be in the body for a little bit. Okay. Yep. Let's pass back here to the gentleman, and then go back.
So I'm an orthopedic surgeon and I do a lot of very painful procedures. 2 of the things that I'm most concerned about, first of all, is controlling their pain. The second one is preventing infection. A lot of my patients won't have the opportunity to take Vitalite or Immune or Revive for a period of time prior to their procedure. My question is this: how much time do you think would it take to upregulate their immune system if I get them on immune? Would it be a 2-week dose, a month dose? Are there any studies that show, okay, you ramp up if you're taking a month's worth of immune to about 75% of what we would hope you could get to?
Yeah, great question. The ingredients that are part of our adaptive and innate immune system blends, vitamin C, elderberry, those types of ingredients, those are usually from what I've seen in the scientific literature, 7 to 10 days sort of thing to ramp things up.
Okay. And then with Revive, would you recommend they take that preoperatively or just something to use postoperatively?
That's something that the medical doctor would need to decide. That's something that you would need to decide. I was just saying in general, knowing what the product does, right? So this product with its phosphoric acids and its curcuminoids and its thymoquinone, black cumin seed oil, helping to downregulate inflammation through epigenetic pathways. I mean, hopefully that would be enough information for the medical doctor to figure out how they want to use it. But, you know, based on the scientific literature, which is all I could say as a chemist, a PhD chemist, the mechanism of action would be helpful for both, in theory.
And then one final question, are there any of the products, the 3 cells, that are known to cause blood clotting to be delayed or slowed?
Blood clotting to be delayed. So Revive, with its curcuminoids and its boswellic acids, can have a blood thinning type property to it in some individuals. And so that would be something that the medical professionals should know, and people in general who are taking those. That's a classic case why we should ask our medical doctor before taking any supplement if we're on prescription drugs or have issues there. Dr. Baker. We're Dr.
Medical doctor coming up.
2 things. First of all, I think that's a great question about curcumin, because we're aware of the possibility of taking it for long periods of time at high doses, possibly low-grade anemias, those kind of things. I've used it on patients ever since we've had it. I've never had that as an issue. Okay? So it's something that I make people aware of it. We're not treating diseases, curing this, or preventing that. But again, I do tell them that is a potential thing to watch for. And I'm checking labs on all my patients frequently anyway, and I've never had that to be an issue. Back to your orthopedic question real quick. You know, I take care of a lot of people. I see a lot of people are orthopedists for knees and hips and shoulders and that kind of stuff. When necessary, as a last resort as an internist, I don't want to do that, but sometimes you have to. We're supporting a healthy immune or a healthy inflammatory response. It's awesome. I think you'll see a big assistance in your care by using these orthopedics.
Dr. Galatian, please.
Going back to, I'm a pain doctor, and so I work a lot with orthopedic spine. In fact, one of my parts is an orthopedic spine, one of the biggest in Southern California. But in terms of using products like Revive, American Society of Regional Anesthesia, I think we need to stay away for about 7 days at least. 7 days at least. And then also with the GLP-1 mechanism, I would recommend holding for at least 1 to 2 weeks. And it's just for safety, because you don't want one case can do a lot of damage. So we want to make sure you are safe, your patients are safe, but I really recommend at least 7 days off the Revive prior to any type of surgical or any type of spinal injections like what I do, including the Vitality as well.
Awesome. Okay, where are we? Mike in the back corner.
I am a PhD in biochemistry, so I have not used any product pretty new to 3, but I am amazed because my father has amazing result already, just like living testimony here. I'm also amazed by like the study that you already did, because like I haven't seen any nutraceutical product like company doesn't make the effort to really do a in vitro study at all. Like, so like the fact that you went through all the mRNA study, and amazing. So 2 questions. Like, first, like, are you planning to do any in vivo study in the future?
Absolutely.
Cool.
Yeah, we have a robust clinical study program that's
cool. And like, is any clinical study already published, or?
Yeah, so these 3 studies that we have are white papers, and we're in the process of peer review.
Okay.
So put them in journals.
Cool. Did you put in bioarchive or anything? Like.
Not yet, because we want to go through the peer review process.
So, okay, so it's like submitted already, or not yet?
It's in the peer review process.
Cool.
Yeah.
Well, how can I do it? Like, well, I'm very nerdy, so I have a lot of nerdy, detailed question I don't think is suitable to be asked here.
Yeah, once the paper is
So
published, you and I can nerd out on it.
Sweet. Like, well, you promised me that, right? Like, you will answer my call. Cool.
Let's do it.
Now, the other second question is like, a lot of recommendations here is like, as you say, like, we have like some of dosage we need to be before, we need to be careful like when do we stop and start again. It depends on condition, and that is only medical professionals' advice. My doctor hates nutrition.
Yeah.
how do I convince him? Or
That's-
or the other side is like, how do I get the information, like the handbooks? Like, well, I think I'm educated enough, I can self-study a little bit and dose myself. But how do I get like the precise recommendation that you guys just was discussing? Well, it's hard in Utah, unfortunately, to find a really medical doctor that really support.
Yeah, so it's
Or if you have any recommendation in Utah,
it can be a catch-22.
Don't try. I mean, I say this with all sincerity. You in this room are going to change health in America. And so honestly, I salute him. You know, the research is going to help, but doctors are so slow to change that our products are safe. When it comes to dosing, think about, I am true of her, so obviously I can take twice as much, right? But let's get back to the doctors. Don't try. I know that we think if doctors are going to be this great revenue stream, they really aren't. And when it comes to disciples of wellness, that is on you. Doctors are not about wellness. So I am encouraging each of you to take this very seriously and don't be trying to change the system. Let's invent a new system.
Okay.
Oh, did you have?
One last question. Like, if I'm going to study for myself, where is my handbook? Like,
Where's your handbook
like
to study
how
for
do
yourself?
I study like with each product and everything, like with like
On our website, in our library, we have videos, we have studies that you can look at.
There's a library. It is like a private website for.
And it's called our back office. Your father can help. Okay, let's pass the mic down to Dr. Oh, did you? Okay.
I'm fairly new. I've only heard of 3 in the last 2 weeks, and
Welcome.
I'm reading the ingredients. Thank you. And I see that some of your products do have gums and silicones and the synthetic sugar. Do you ever see a future where you'll maybe use other products instead of the gums, which can be inflammatory?
Yeah, all of our products are natural. We don't have synthetic sugar in it at all. So all the ingredients, they're all natural source. The gums are natural as well. The amount of the gums that we use are not inflammatory in our clinical studies. So what, you know, a lot of it is the dose that's used, right? I mean, the dose determines the poison is the old adage there. So the small amount of the gums from the natural sources we use, we have in the studies that we've ran, we've seen no inflammation. Yeah, great